But because all of them are involuntary, now pay attention to what I'm saying, all of them are involuntary, they all have to gradually disappear after birth. If they continue to be persistent even after birth, they will interfere in the appearance of milestones. I'll just give an example of one important thing: asymmetric tonic neck reflex. You turn the head on one side, arm extends. So the arm is extending on the side where the head is turning. Now, this, if it persists after birth for a long time, what will happen? Our hand-eye coordination will never appear. At present, what I can do is I can write, and at the same time I can look at the back also. My hand and my head are not going in the same direction. This hand-eye coordination now is present because my asymmetric tonic neck reflexes have disappeared. So all these primitive reflexes, which are very important in the intrauterine life, after birth they have to disappear for the voluntary milestones to appear. So let us see the timing of appearance and disappearance of these reflexes, which is again very important from your examination point of view. The grass reflex, which is the first primitive reflex, appears at 28 weeks of intrauterine life. So it appears at 28 weeks, one of the first reflexes among these to appear. And it disappears 3 months after birth. So after 3 months, you just try to introduce your finger into the grasp of the child. Now the grasp will not tighten. So please remember, the grass reflex appears at 28 weeks of intrauterine life, and the grass reflex will disappear at 3 months after birth. So it has to disappear. Then the rooting reflex. The rooting reflex appears at 32 weeks of intrauterine life. Please don't confuse. These are intrauterine life periods. So rooting reflex appears at 32 weeks of intrauterine life, and it disappears 1 month after birth. The Moro's reflex, I was telling you what are the components of the Moro's: abduction, opening up of the fingers, and then an adduction. So Moro's reflex, it appears between 28 to 32 weeks of intrauterine life, and Moro's reflex disappears by 3 to 6 months. Please remember another very important FMG question: persistence of Moro's beyond what age is abnormal? Because it should disappear max by 6 months. If Moro's reflex continues to persist beyond 6 months of age, it is abnormal. Persistence of Moro's beyond 6 months is abnormal. Please write down: grass reflex appears at 28 weeks of intrauterine life. It disappears at 3 months after birth. Rooting reflex appears at 32 weeks of intrauterine life, and it disappears at 1 month after birth. Moro's reflex appears at 28 to 32 weeks of intrauterine life, and it disappears at 3 to 6 months after birth. That is why Moro's reflex, if it persists beyond 6 months, it is abnormal. ATNR. ATNR is the very abbreviation of asymmetric tonic neck reflex. Asymmetric tonic neck reflex. I told you, you turn the head of the child to one side, arm of that side will extend, arm of the opposite side will flex. So arm of one side extending, arm of the opposite side is flexing. This is asymmetric. So ATNR's, asymmetric tonic neck reflex, also appears at 35 weeks of intrauterine life, and it disappears at 5 months after birth. So grass reflex appeared at 28 weeks of intrauterine life, disappears 3 months after birth. Rooting reflex appears at 32 weeks of intrauterine life, disappears 1 month after birth. Moro's reflex appears at 28 to 32 weeks of intrauterine life, disappears at 3 to 6 months after birth. Asymmetric tonic neck reflex, ATNRs, appeared at 35 weeks of intrauterine life. It disappears at 5 months after birth. So these were the 4 primitive reflexes that I told you, primitive reflexes. But one reflex which is not a primitive reflex, because this is a reflex which is appearing, see here, 6 to 9 months after birth. It's not a primitive reflex because this is a reflex appearing after birth. So this reflex is known as the parachute reflex. What is a parachute reflex? Take a child, please see this, take a child upside down. So now the child is upside down on your palm. So this is your palm. Put the child upside down on your palm. and suddenly lower the palm as if the child is about to fall. Suddenly the child's arms will extend like a parachuter. This is why it is known as a parachute reflex. Because the parachute reflex appears 6 to 9 months after birth, it is not appearing at birth, it is appearing after birth. Therefore, it will be a non-primitive reflex. So what is the time when parachute reflex appears? 6 to 9 months after birth. And this is one reflex which persists throughout life. It never disappears. It never disappears. It persists throughout life. So just once more, grass reflex appears at 28 weeks of intrauterine life. It disappears at 3 months after birth. Rooting reflex appears at 32 weeks of intrauterine life. It disappears 1 month after birth. Morose reflex appears at 28 to 32 weeks of intrauterine life, disappears 3 to 6 months after birth. So persistence of morose beyond 6 months is considered to be abnormal. Asymmetric tonic neck reflex appears at 35 weeks of intrauterine life. It disappears 5 months after birth. But one reflex which does not appear before birth, it appears after birth, is a parachute reflex. There is one more reflex that I'll talk about later, but this is one reflex which appears after birth, therefore is not a primitive reflex. When does a parachute reflex appears? It appears at 6 to 9 months after birth, and parachute reflex persists throughout life. It never disappears. Most of the other reflexes, as you can see on your screen, are disappearing, but parachute reflex is non-disappearing. It is known to persist throughout life. I hope you have all written. So finally, if you see at the bottom, which is the reflex which is not present at birth? So suppose they give you 4 choices, then they ask you which of these are the reflexes which are not present at birth. Your answer will be these 2 reflexes. One is the parachute reflex, which is never present at birth, and one which I just now told you is a symmetric tonic neck reflex. Both of them are known to appear after birth. So they appear after birth. Because they appear after birth, they are not known as primitive reflexes. A primitive reflex by definition is a reflex which is present at birth. Any reflex which appears after birth will not be called as a primitive neonatal reflex. So which are the reflexes which are not primitive? One is parachute reflex and one is symmetric. What is symmetric tonic neck reflex? Extend the head of the child, both the arms extend, both the legs flex. Actually, this is a reflex which helps in crawling. Just see this. You can see this is symmetric tonic neck reflex. This is symmetric tonic neck reflex. It appears just before crawling. So it is basically a reflex which helps in crawling. Crawling, if you remember milestones, I told you crawling appears at the age of crawling and creeping, I was telling you. So crawling, I told you, appears at 8 months, creeping at 10 months. But creeping at 10 months is on level ground. Creeping on stairs, 15 months. So in crawling, when the hand of the child is extended, head of the child is extended, both the arms get extended and both the legs get flexed. So this is known as a symmetric tonic neck reflex because it is known to appear just before crawling. So it is appearing after birth. Just before the child learns to crawl, this reflex appears. So this is a non-primitive reflex. And this is the parachute reflex, which I have already explained to you. In a parachute reflex, just put the child upside down on your palms, suddenly lower the child, there will be fanning of the arms like a parachuter. So this is a parachute reflex. When does it appear? It usually appears between 6 to 9 months. Therefore, it again is not a primitive reflex. So which of these reflexes are not primitive? One is parachute reflex, which is not primitive. The other is a symmetric tonic neck reflex, which is not primitive. Which are the reflexes which are primitive? One is the grass reflex, one is the rooting reflex, one is the morose reflex, and the other is asymmetric tonic neck reflex. ATNR, asymmetric tonic neck reflex. Right? So, just a few things that I would like to revise before we close today's class. I hope this class was helpful for you till now. We'll just so I started this neonatology class by telling you about the specifications of the newborn. So I told you the length of a newborn is 50 centimeters, the head circumference of a newborn is 35 centimeters, upper segment to the lower segment ratio is 1.7 is to 1, heart rate of a newborn is between 110 to 160 per minute, and respiratory rate of a newborn is between 40 to 60 per minute. Then certain other definitions that you should be aware of: low birth weight when the weight at birth is less than 2.5 kgs, very low birth weight when the weight at birth is less than 1.5 kgs, and extremely low birth weight when the weight at birth is less than 1 kg. I also told you newborns do not shiver, newborns do not sweat. So the principal method of heat production in a newborn is lipolysis of brown fat, which is known as non-shivering thermogenesis. Then all children should pass meconium within 24 hours, and all children should pass urine within 48 hours. Meconium is the black colored first stool of a newborn which is passed till day 3. Fourth and fifth day you have greenish colored transitional stools. After the fifth day you have the mature golden yellow colored stools if the child is on exclusive breast milk. In the temperature of a newborn normally is between 36.5 to 37.5 degrees centigrade. If the temperature is less than 36.5, we call it as hypothermia. If it is more than 37.5, we call it as hyperthermia. Hypothermia, which is temperature less than 36.5, further is divided into 3 subcategories. So temperature between 36 to 36.5 is cold stress, warning signal. If it is between 32 to 36, it becomes mild or mild to moderate hypothermia. Less than 32 then becomes a very, very severe life-threatening condition, which should always be prevented. This is severe hypothermia. Why is it so important to maintain the temperatures of newborn? Because newborns lose heat very quickly. So what are the 4 methods by which newborns lose heat quickly? Coming in contact with a cold surface, conduction. Near a cold surface, not in contact, radiation. Near a source of cool air is convection, and loss through the skin, evaporation. Which is the most common method of heat loss at birth? It is evaporation. Please remember, to maintain the normal temperature of a newborn, it's very important to maintain the temperatures of a nursery or NICU. So what should be the normal temperature of nursery or NICU? The normal temperature of nurseries or NICUs should be about 25 to 28 degrees centigrade. That's the normal temperature you should maintain. Kangaroo mother care, another important method by which you should keep you can keep the newborns warm, especially if the child is a low birth weight or a preterm child. Now, what are the 3 components of kangaroo mother care? First, most important component is skin to skin contact. Second important component, early initiation of breastfeeding and timely discharge from the hospital. It should be given till the child achieves a post-birth gestation of 37 weeks and achieves a weight of more than 2.5 kgs. But what is the cutoff weight after which you can start? You can start kangaroo mother care only when the child is more than 1.8 kgs, and that too he should be hemodynamically stable. Any child who is in shock, any child who is having signs and symptoms of infections or septicemias, please do not start kangaroo mother care. It can be highly dangerous. Then I told you 3 important definitions: small for gestational age, large for gestational age, and appropriate for gestational age. So when the birth weight of a child is less than 10th percentile for that gestation, the child will be called as small for gestational age. When the birth weight is more than 90th percentile for that gestation, child will be large for gestational age. When the birth weight is between 10 to 90th percentile for that gestation, the child will be appropriate for gestational age. Small for gestational age is also known as IUGR, intrauterine growth retardation. Please remember one more thing: infant or diabetic mothers usually are large for gestational age babies. Very rarely small for gestational age, they are usually large for gestational age babies. In addition, I told you preterms and IUGRs have many common complications, one being neonatal hypoglycemia, which can be complications in both, and neonatal hypocalcemia, which can be complications in both. Very important question: what is the definition of a neonatal hypoglycemia? It is blood sugar less than 40 milligrams per deciliter newborn. Do not confuse it with childhood hypoglycemia, as in malnutrition, where the hypoglycemia is blood sugar less than 54 milligrams per deciliter. Right? Intracranial bleed, however, is much more common in preterms, very, very rare in IUGRs. What is the most common site of intracranial bleed in a preterm infant? Please remember, it is germinal matrix, the area just around the lateral ventricles. between the caudate and the thalamus. That's the area most commonly like to bleed in the brain of a preterm. Then I talked about neonatal reflexes. So all reflexes which are present at birth will be primitive. Reflexes which are not present at birth will be non-primitive. Primitive neonatal reflexes are rooting reflex, then grass reflex, Moro's reflex, asymmetric tonic neck reflex. There are many more, but these are the ones which are important for your exams. So two important neonatal reflexes which are not primitive because they appear after birth are symmetric tonic neck reflex and the parachute reflex. Parachute reflex is one reflex which persists after birth and it usually is not known to disappear. Symmetric tonic neck reflex, as I told you, appears just before crawling but is known to disappear after crawling. Right? So with this, I hope today's lecture was useful for you. I hope you found it useful in all aspects. We can take a 3-4 minutes break. If you have any questions, you can give me a call and you can send me some questions. We can take those questions. The remaining class will continue tomorrow starting from 10:30 a.m. So we'll take around 3-5. I'll take around 3-5 minutes. If you have any questions, you can send them along to me. Thank you.